So what are some of the challenges that you've had to face and how have you overcome them within your career?
I think every step of the way, I think every single step gets more selective. See, just like getting into college, there's some people that don't get into college, and the med school, there's some people that don't get into med school. Orthopedics, a lot of people wanted to do that. And so there are a lot of people that weren't able to do that. And so you kind of have to really set yourself up for those challenges. Facing orthopedics and facing any medical specialty in general is just figuring out how to stay afloat and stay profitable with the declining reimbursements. For example, like a little hip fracture or something that we do, that the same surgery we've been doing probably for 20 or 30 years, the reimbursement is probably a fifth of what it was in the early 90s. And the costs have exponentially gone up to run a practice and things like that. So the margins keep getting smaller and smaller and smaller. And so I think the issue with that is as the margins get smaller and smaller and smaller, the talent pool that you're going to draw to go into medicine, that you're going to draw to go into surgery is going to keep decreasing as the margins of revenue and salaries and things like that continue to increase in business and tech and all in the industries. You're going to lose out on these people. So I think that's the biggest challenge facing kind of medicine in general is how do we keep these people that are smart enough, have knowledge enough to kind of keep advancing these fields to even attract them to medicine anymore. And it's a difficult situation. As more people age, we'll have more and more people, on insurance, and just figuring out this problem, I think, is kind of the challenges